Hi, Dr. Scott here, and we're talking about our last pattern, which is pattern number 6, which incorporates 90% of everyone that has a thyroid problem. This is part of their problem. It is called Hashimoto's disease. And what Hashimoto's disease is, it's an autoimmune condition. And so with these patients, what happens is their immune system attacks the thyroid gland. It shouldn't be attacking the thyroid gland, it's like attacking itself. And it destroys tissue, and it can actually eliminate your thyroid altogether over time. Now, if you have Hashimoto's disease, there is no cure for it. Okay, you just have to manage it. But you can have Hashimoto's and have no symptoms if it's managed right. And the key factors with that is to prevent triggers. What is triggering that immune system to turn on, to attack itself? Many of our patients have 4 to 5 different triggers. Many times, hormone shifting is a huge factor with autoimmune conditions. In fact, you look at most patients that, the demographic, what sex they are, they're mostly women. You look at the women's cycle every month, their hormone shifts like crazy, where men's are pretty stable. This is partially why you can have problems if you're a female with autoimmune conditions. For example, some of the triggers can be you get, your period at 13, or you have pregnancies, 1 or 2 pregnancies, or any pregnancies can trigger this to turn on. Menopause can trigger it on when you're later in life. Even surgical menopause, maybe you did a hysterectomy, that can trigger it. Food sensitivities like gluten, dairy, soy, or in particular can cause problems. And actually, any imbalance in your body can trigger this to turn on. Many times we're looking for life events, so stressful events like divorce, a death in the family, stressors, auto accident, you name it, it could be triggering that to turn on. Well, the question is, how do you know what's wrong, or if you have Hashimoto's disease? Very easy to run a test. It's called a TPO antibody test and an antithyroglobulin antibody test. And you'll know for sure. Now, when we run it, it's different than what most doctors run. We are not going to look at the reference range that come from the lab. So I use a lot of LabCorp labs. Now, on LabCorp, the reference normal range is 0 to 34. Okay, so let's say we check your lab and you're at 30. The lab says you're normal. You get so frustrated, you go to Mayo Clinic, and then Mayo Clinic runs it and they say that you're positive because their reference range is 0 to 9. So you can see that, that's why many people are told they're normal or they don't have Hashimoto's when they really do. So we're going off a lot of Mayo Clinic reference ranges. And that's how you know if you have Hashimoto's disease. Now, when we wrap everything up with all these patterns, not only do you need to run the specific test for each pattern, but you also need to run a blood test, saliva testing, maybe a stool sample or a SIBO or hormone testing. You have to look at the whole person and fix all of their imbalances if you ever want to have a chance of getting your life back. So finally, if you're sitting there struggling and you're ready to give up hope, there is hope for you. You just need to go to a practitioner who knows how to do these things. Like I said, most doctors hang out in pattern 1 and that's all that they do, which is fine. They're helping people there, but there's about 90% of the people that they're not going to die, but they just feel crappy all the time. And that's where we step in. So hopefully you got some information from this and you have more understanding. If you want to see if you're a candidate, we're offering basically 2 things. You can do a complete thyroid panel. Here's a thyroid panel that you need to pull. Here it is right there. You need to pull all of those. The problem is most insurance companies don't want to pay for all that because they only want to see if you have thyroid hormone replacement, that's it. So we pull all of those. Those are expensive tests, usually around $1,000 to $1,200 just for the testing. Now what we're doing for $199, you can get the test. It doesn't matter where you are in the country. We can get the testing, you'll get a consultation with me, and I'll interpret your labs for you, all for $199. Now, if you want to do the thyroid panel, plus you want to do all the other standard tests that we run, for $699, you can get all of that. Now, you'll be getting close to $5,000 worth of tests, plus me to interpret it and a consultation with me, all for $699. Take your pick. Either one is fine, but those are some 2 options. You're getting discounts that we have as well. So if you want to do that, message us, contact my office. There'll be links here that you can do that. But I wish you the best, and we'll go from there. Thanks. See you on my next video.